My name is Dr. Alexandra Wolanski. I am a hematologist at the Mayo Clinic, but I'm also the Senior Associate Dean for Student Affairs at the Mayo Clinic School of Medicine. And it is my pleasure today to speak to you about a publication in the Proceedings titled Milestones and Millennials, a Perfect Pairing, Competency-Based Education and the Learning Preferences of Generation Y. This was an idea that came to me following a national presentation on the topic of how millennials learn best, an area that I have a particular interest in, and also trying to consider our new method of assessment through milestones or competency-based assessment for our residents and fellows. So competency-based education is an evolution of how we assess medical learners. The Accreditation Council of Graduate Medical Education, also known as the ACGME, had previously developed a list of competencies that assessed the process of learning, and rather than true outcomes or behaviors that allowed one to determine whether or not a medical learner was able to work independently as a professional. And so our current mandate through the ACGME is to train residents and fellows through milestones-based assessment, identifying entrustable professional activities, or EPAs, defined for each specialty. Now, this has begun to transpire into undergraduate medical education and across certain medical schools, including ours. And this mandate truly is essential for a number of reasons. Probably most important is public accountability of how we are training physicians. Millennials, also known as Generation Y, is our most prominent generation in the workforce and our most prominent generation illustrated among our medical learners. And this applies across all specialties. It applies across the entire continuum of medical education, as well as different types of healthcare workers. And so, speaking a little bit more about what competency-based assessment is, it is a stepwise behavioral-based assessment that begins from one would consider a novice level and goes through a variety of steps to eventually reach what we would title aspirational. And the ACGME really has taken the lead in developing these milestone-based assessments, but other countries have taken notice, and so Canada has begun the process of transforming their assessment to also be milestone-based, but so have other countries across the world. And so this is truly not just the way of the present, but the way of the future. Now, millennials are a beautiful generation, and I do think they get a bad rap. They were born approximately between 1980 and 2000, and if one could characterize this generation, the adjective that would be most suited is actually hopeful, which surprises people, I think. At the time that they were raised by their Gen X parents or their baby boomer parents, born between 1960 and 1980 and 1940 and 1960 respectively, psychologists told them you cannot overcompliment a child. And so you should always make them feel special. And a lot of parental interference as well with regards to problem solving, etc. And so we have made this generation somewhat dependent on adults to run interference and to always champion their cause. When one looks at what was happening from a technology standpoint, these are internet natives. They don't know what it's like to not have the internet at their fingertips. There are advantages to that. They're able to access any information that they want at their fingertips, which makes them a little bit impatient because they're used to being able to access anything they want at any time. But the downside to that is they've been exposed to the suffering around the world and the plight of the world. And because of that, they are extremely socially minded and very, very much involved in bettering the world and the society around them. They've also, as I stated a little bit before, been exposed to tremendous violence, and so they do carry a heavy burden, and they do not take their medical education for granted, nor their calling to be physicians. It is something that they take very seriously and are very deeply committed to. They are constantly seeking mentoring relationships. They are looking for individuals who will care for them. They don't have to serve as a parent per se, but they do have to care about them individually. And it's important for them to understand, if you ask them to do something, what the explicit goals are so that they can stand behind it as they begin to understand how that will help them. It's also important for them to practice in teams, which fits so beautifully with competency-based medical education, where teamwork is an essential component. In addition, technology is very important to them, and they work very well within a technology-literate environment. As a matter of fact, I think they can teach us quite a few things. But the importance there is that it allows messaging that can be broadly shared. It allows for communication among individuals who may not be geographically close to one another. And again, this is very consistent with the direction of not just medicine, but the business world, etc. With regards to professionalism and emotional quotient, I think that overall there is a sense that this generation can appear to perhaps not strive for the same professional ideals that earlier generations might. I think to some degree they are somewhat misunderstood, but on the other hand, one has to consider that the helicopter parenting that I referred to before has disadvantaged them in some way, and so overall they do need more individualized training and role modeling in these aspects. Millennials love to receive feedback. As I said earlier, they're used to just pushing a button and getting anything that they need, and so they strive on continuous feedback, and if you ask them, they would love to get feedback 24/7. What is wonderful about the milestones-based assessment is they are in fact continuous. They follow a continuous spectrum, and our learners are constantly being evaluated. The second thing our millennials like to receive in feedback is specific feedback, explicit feedback, feedback directed towards their ultimate goals. Milestone-based assessment allows the individual who's providing the feedback to be very specific to what skill sets this millennial learner would need to work on. And so it's sort of an individualized education plan. Millennials set actually extremely high standards for themselves, and they also expect that in their professors, their teachers. They don't just want to be good at what they do, they want to be fantastic at what they do. They recognize that they want to have an impact and make a difference in the patient population that they ultimately hope to serve. And so in summary, I think that millennials and milestones truly are a perfect pairing. I hope I've made the argument to convince you on that. If you'd like to learn more and dig a little bit deeper, I invite you to read the article that will be published in the February Proceedings. Thank you very much.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.